what do you think would be the fastest way to get skin cancer, rapidly age your skin, and decrease your lifespan that people might actually be commonly doing?
Ooh, that's an excellent question. The most common thing that I would think of right off the bat, from at least an aging standpoint, is repeated sunburns. I see this all the time, especially in the beginning of the summer season as it's coming around now, is people think they can harden their skin, or they can, if they get their first burn, they'll build like a tolerance. And that's a very common misconception. It's perpetuated all the time, is that you get that first tan, that first burn, and you build a layer upon that. And I mean, if you just look at a piece of hide that's put out in the sun, it becomes tan leather. Your skin is no different, right? I think the things that people don't realize is a sunburn is literally your body telling you you killed it with too much UV exposure. It's literally the top layer of your skin's dying off. That's what a blistering sunburn is. So the common thing that I see, particularly as May comes around and June comes around, is people get that seasonal first exposure, and it's usually the worst. If you can mitigate that, if you can reduce your exposure to gradual UV increasing, or if you can do early morning or late afternoon, you'll save yourself from probably 80 to 90% of the damage that you usually see long term.
So the sun, like getting burnt by the sun, is the big culprit, because you hear a lot when people talk about skin health. They talk about lifestyle habits, diet, and exercise. Like what role do those things play compared to like getting burned by the sun?
Dermatologists make a big stink about the sun. We talk about this all the time, but it's not the sun per se. It's the excess cumulative UV exposure, and it doesn't matter whether it's sunlight, artificial tanning beds, whether it's other sources of UV or radiation exposure. A lot of people who work in the airline industry are flying at altitude. They get X-ray and gamma radiation that we don't get on the floor, and they have about a 10 times higher risk of skin cancer than you and I, who live at normal sea level or altitude. So it's not the sun, it's the perceived absorption and cumulative dose of too much UV and mutating radiation, so X-ray, gamma ray, cosmic rays, etc. The sun always is overwhelmingly more powerful than small things like diet and exercise. However, when you stack up diet and exercise and lifestyle habits over 30, 40, 50 years, then it becomes similar. The problem is we don't have enough concrete data in lifestyle and diet the way we do with UV exposure to say, this is the diet that's bad, this is the lifestyle that's bad. When we run tests, we look at, scientific studies. And when we do scientific studies, we look at, lab tests, bench and bedside studies. And with sun, you can replicate that in the laboratory. You expose something to UV. It's a pretty concrete A plus B equals C study. With diet and lifestyle, it's really hard to synchronize and control for variables across people, across populations, across societies. So that's kind of where the murkiness lies. I think, and we will see this, we're starting to see this now, in that really poor diet and lifestyle choices, particularly things that will modulate or weaken our body's immune system, play an equivalent role in cancer development overall, not just skin, but overall. So, and this is being perpetuated in the literature. We're finding younger and younger patients developing cancer, whether it's cancer of the skin, there's an epidemic of colon cancer, there's an epidemic of lung cancer in non-smokers. So you're scratching your head saying like, well, my generation, the generation younger than me, are probably the most sun adverse people ever, but they're still developing things on their skin that will kill them. The younger generation is the least smoking, the least in environmental pollutants like arsenic, tar, coal, but they're developing colon cancer at a rate that's far exceeding anything we expected. So you're scratching yourself saying, what's the unifying theme here? And it's actually probably diet and lifestyle.
And so what are some of the common habits from a diet and lifestyle perspective that that you think stack up over time that can actually make your skin health pretty bad?
So poor diet choices, poor lifestyle habits that contribute to a weakened immune system. And how do I like rectify this? So before we pinpoint diet and before we pinpoint what lifestyle habits, we have to understand that there's a really, really strong connection between our gut, the gut microbiome, our body's immune system, and the skin microbiome. And the gut is thought to be an entire second brain to our bodies. It's kind of like why, like if something bad is about to happen, you get a feeling in your gut, that gut feeling. There's some truth to that. It's thought that the nervous system in the gut is our primitive brain. There's a whole microorganism world, universe in our gut that controls our body's immune system. And as the gut microbiome metabolizes things that regulate our immune system, it affects our body's ability to survey damage that's occurring and control it. So we're now just realizing in studies that have been going on for 20 years that gut immune homeostasis is really important in preventing cancer development and cancer progression. So when people eat really crappy diets, when people eat really high processed foods that are not meant to be consumed, that are not really biologically healthy foods, over time, our gut microbiome doesn't like that. The metabolites from its struggle to process these function as immune suppressants. And over time, that immune dysfunction leads to things developing that shouldn't develop. Our immune system is basically the police of our body, right? And its job is to survey and destroy things that shouldn't be there. And everybody has a certain amount of cancer cells circulating somewhere in their body. We have it on our skin, we have it internally, we have it in different organ systems, and our immune system does a really good job at finding them and destroying them, which is why cancer tends to be a problem of, generally, it used to be a problem of adulthood. As our immune system got weaker, surveillance got a little bit worse, and things start to break through that used to not be able to. But now you're throwing a wrench in the system. You're not allowing your immune system to function at optimal health. You're eating things in which the metabolites tend to be inflammatory, cause a lot of dysregulation, and you can imagine how over decades this really cripples the body's policing system.
And so if you were to flip that on its head, like what do you think are the best diet and lifestyle habits for people to follow to make sure they're having the best skin health possible?
Yeah, I think number one, I put all my patients on an anti-inflammatory diet right off the bat. And there's various forms and iterations of an anti-inflammatory diet. Mediterranean diet is one of them. Generally, paleo type diets tend to be one of them. So things that are low in processed sugars, gluten-based carbohydrates, obviously minimal alcohols. Those are things that we can do that we can actually see a change in skin health right away. Things like psoriasis, eczema improve, and we know, hey, with just diet alone, we're improving inflammation in our body, and you can see that. So that's number one. Number two, I know this sounds silly. My grandparents used to say this. My parents used to say this: sleep. Things get fixed in our body during sleep. Immune surveillance increases during sleep. Anabolic growth, whether it's muscle or brain development, especially in younger ages, occurs during sleep. So getting adequate sleep is really important. There's many studies that show that people who have either overnight shifts, like people who work graveyard shifts, or people who chronically sleep less than 5 hours a day, have a weakened and impaired immune system, and their ability to heal decreases significantly. So sleep is another simple thing. And then, believe it or not, I tell a lot of people to get outside and start to get moving. And it can be in the sun, it can be in the shade, it doesn't matter, but you want to get outside and get moving. And why do we know that? Why is that important? One, we know moving will make you feel better. And there's a component of feeling better that contributes to overall wellness and well-being. But number two, we know that moving increases muscle mass, increases aerobic activity, which results in overall health. And a new study that just came out in one of our most prestigious journals, Cell, showed that movement with muscle is one of the biggest things that contribute to lymphatic circulation, which clears cancer cells throughout the body. So I say, eat a good diet, get some sleep, start moving, and you'll be surprised how much healthier you are overall. The problem with the United States is it's easier for me to give you a pill than it is for me to say, hey man, don't eat this pizza, stop drinking the beer, eat something clean, get outside, start working out, get some sleep.
So when it comes to getting out in the sun, like what would be a good like protocol to follow to make sure that you're optimizing skin health, but you're not causing skin cancer?
Individualized medicine is very important, and it's a phrase that's been coined more recently now, but it's been around for since the generation of dawn in medicine. In that understanding your body's specific needs and limitations are really, really important. And my recommendation is going outside for the time that it takes for your skin to turn red is what's called your minimal erythema dose, right? So I can tolerate being outside. I'm a little olive complected. I can tolerate being outside for an hour and a half before my skin starts to turn red. So anything less than that, I'm comfortable with my patients or my friends or family to be outside unprotected. If Doug, you told me, hey, I go outside and my skin turns red in like 15 minutes, I would say, well, your relatively safe, unprotected level is less than that, right? So, simple fact number one, you can go outside as long as you want, just don't burn. If you burn easily, you pick times of the day in which the UV index is lower, early morning, late afternoon. Most people are not stronger than the sun. So midday sun is something where most people will need some form of protection. And, you know, we actually talked about this recently on another podcast, in that runners in Kenya, and they're some of the most darkly complected patients in the world, runners in Kenya will wear full coverage when they're training for marathons in Kenya. You would assume like they don't burn easily, their risk of skin cancer is much lower, but they understand that there's consequences long term that will hurt them. And instead of putting on westernized creams and things like that, and I don't know if it's an availability issue or an access issue, or they just grown up this way, they'll cover up when they're on long journeys in the sun. So number one, don't burn. Number two, kind of find out or know how much your skin can tolerate. If I can tolerate an hour and a half, I'm going to be out in 45 minutes. I'll be back inside. I'll be fine, right? And then if you're really sensitive, you have a history of skin cancer, or you have sun-sensitive skin conditions, pick early morning, pick late afternoon.
Okay, because there's been kind of some controversy, I guess, over the years about can you still get light, like sunlight, if it's like cloudy. I know Huberman obviously has been like, hey, like doesn't matter if clouds are out, clouds aren't out, like you still can get sunlight. Do you still think that it's effective if you go out in the morning and it's cloudy, the sun's not out yet, to be able to get sunlight?
I do, and it's funny you say that. So, and I'm going to put myself on blast. I've gotten many sunburns in my life as a kid and young adult, and some of the worst ones have been in overcast days at the beach. Right? It's like you assume that there's nothing out there. It's even cold. You're like, I'm not going to get, and you come home and you're burned. So there's a component of visible light that gets transmitted through clouds that does play an important role. There's a component of UV that comes through clouds that you don't see that can eventually hurt you. I think going outside and seeing natural visible light of all spectrums is better than being in indoor and artificial light. Doesn't matter whether it's cloudy or a full sunny day.
Is there any types of like products, like cosmetic stuff, that you think people are putting on their skin, and if they're not careful, it can add up and just be bad for them?
Yeah, many of things, and it's probably going to get me in trouble in my own dermatology community, but I tend not to like chemical sunscreens. Never have, never will, and everybody will fight with me on saying, well, the studies don't show harm to humans, and the dose is low enough that it doesn't hurt you. My thought process to this is very, very simple. If you have a category of product that has minimal to no concern whatsoever, and you have a category of product that has even smoldering evidence, for me as a doctor, my my primary goal is to keep you safe. I don't really, and maybe it's my own fault, I don't really care about how it goes on or how elegantly it sits on your skin or whatnot. If my goal is to protect you, I will pick the one that has no concern or side effect. If it goes on a little chalky, so be it. My goal is to protect you from sun damage, skin cancer, and premature aging. So there's enough smoldering evidence from chemical sunscreens to begin with that suggest some of its metabolic byproducts can be carcinogenic. Some of it can be endocrine disrupting in and of itself. The absorption is a lot higher than we thought. There was a really good JAMA study that showed that single application of a chemical sunscreen on the body at the dose that we recommend as dermatologists had a 200 to 500 time increase absorption that we detected in a blood draw. That is concerning to me. We're telling people to put these products on from childhood to adulthood. We're talking 50, 60, 70 years of constant application. Eventually, you would think something will catch up to you. That's number one. I don't like that stuff. Number two, I tend not to like the acids. And that's just my personal bias, but I feel like we have better products, better ingredients to use than the simple acids people put on their skin for cosmetic rejuvenation, acne treatment, etc. But my biggest culprit right now is the sunscreens that are chemical based, propellants, spray sunscreens. I hate them. 99% of the propellants are benzene derivatives. We inhale them. That becomes a problem. And over time, it's not the one-time application, but the 50 years of spraying on sunscreen and inhaling, that's probably not the best thing for you.
When it comes to things like cancer and diseases of the skin in general, like people tend to blame like genetics and say, you know what, like I have a genetic predisposition to things like skin cancer and issues like that. But I know that lifestyle plays a big role and can trigger like a lot of these genes to get turned on. So like, what do you think is the role that lifestyle plays in things like disease?
So you touch upon a topic like epigenetics or gene activation, gene modulation based on environmental factors. I think they're huge. I think genetics trumps everything. That being said, my family, and I'll give you a simple example, both my mom's side and my dad's side have obesity and diabetes that run rampant in the family. So I know I have the genes for it. Now, can I control for it? For certain. I do all my, I work out, I watch what I eat, and I can get really, really fit if I want to. I can also get really, really fat if I want to. I can assure you that. Genetics plays the predominant role. It loads the gun and it cocks the hammer, but lifestyle and habits can pull the trigger. And that's the simplest way I can describe it. So I see a lot of patients who have a strong family history of skin cancer, and I have relatives which think, it's in my genes, I'm going to get it anyway. And then relatives who are like, you know what, I'm going to mitigate my risk. I know I'm going to get it. Maybe instead of having 10, I'll have 2. So I think lifestyle can modulate your genetic predisposition significantly. Can it stop it? No. Can it reverse it? No. But you can reduce the expression, the intensity of the expression. There's a really good twin study that I think I talked about somewhere in one of our social media videos, in that identical twin studies, and you looked at, they had the same genetics, and environmental factors differed where they lived, where they smoked, where they got sun exposure or not. And you can see physically a marked difference in their health. And that goes to show you lifestyle, habits, diet, and environment can contribute significantly to the expression of your risk factor genetics.
What about stress? I notice like when I get stressed, sometimes my hair will get more flaky, my hair will thin a bit. What role does stress play on skin health?
Stress plays one of the most monumental roles in all of our health. It's insane. And the problem with stress is we can't quantify or measure it in a lab. We can quantify or measure glucose. We can quantify and measure triglycerides and cholesterol. I can't measure stress that easily. And person to person, the stress response is different. What I love about our skin, what drove me into being a dermatologist and a skin cancer surgeon, is you can see the body's homeostatic balance right away in our skin. We can see how our body is doing. It's a window to our soul from the outside. So stress plays a tremendous role. And one of the first places I see it is not just the skin, but in our hair and nails. So when I was a full-time professor over at the university, I used to see young kids come in all the time, right during midterm and finals week, particularly finals week, with clumps of their hair falling out. And every time, it was the same story. My hair is falling out. It's covering my pillow, my bed sheets. Am I going to go bald? And you'd say, okay, how stressed are you? I'm stressed out of my mind. I'm not sleeping. I'm cramming. So there's an actual diagnosis for that called telogen effluvium, which is stress loss or shock loss. Our body uses our skin, hair, and nails as a biosensor and says, well, if I'm really this stressed, do I need to expend energy making hair? I don't need to. I will expend energy healing a part of our body and the hair will fall out. It sheds as a result. But you see it not only in hair, you see it in our skin. You can go online and look at the aging process of US presidents and world leaders, and they have an accelerated age rate compared to the population. And that's because the chronic stress response releases a hormone called cortisol. And cortisol is a glucocorticoid that breaks things down in our body for our body to utilize it as an energy source. And the idea behind that is, primitively, we used to be attacked by animals and lions and predators and what have you. So when we were in a state of stress or shock, we needed to utilize energy to run away from these predators, right? The body doesn't recognize 21st century stress versus 50,000 years ago stress. It still thinks you're being eaten by the lion. The problem is the lion is, the job on Wall Street, the surgeon who's doing life-threatening surgeries every day, the family who's struggling in bills, what have you. So that stress, your body releases this hormone to break down body parts, muscle, skin, collagen to use as an energy source to run away from. So with stress, our skin ages early. Collagen breaks down, elastin breaks down, we form wrinkles, we form hollowing, and you can see that over time.
Like speaking of wrinkles, I know that's something that people get really self conscious about. What do you think is the best way to prevent wrinkles and potentially reverse them?
Number one, protect yourself from too much UV exposure. Number one thing that will age you prematurely is overexposure to sun and UV. Now, it sounds like, hey, Dr. Soleymani, you're making contradictory statements. What are you saying? The sun is good, the sun is not good. I think the sun is great, but too much of a good thing can also be a bad thing, right? And I go back to that like wrinkled leather bag analogy. You put hide outside for a short period of time, it won't wrinkle or tan. It won't wrinkle and turn into leather. But if you keep it out there for a very long period of time consistently, it'll start to wrinkle like wrinkled leather does. Same thing with our skin. The UV exposure and to a lesser extent, X-ray, gamma radiation exposure will break down collagen very, very quickly. Other things that you can do, you want to make sure you're sleeping well. You rebuild collagen at night when you're sleeping. You want to make sure you have an anti-inflammatory diet, things that'll allow your body to heal and maintain a normal homeostasis so your collagen and elastin don't break down at a faster rate. Can you stop them entirely? No. Mother Nature, Father Time will win all. It's inevitable. There are things that we can do to help reduce the rate at which that decline occurs.
Yeah. And if you had to put together like a blueprint for somebody to make sure that they are optimizing their skin health, if they're reducing the risk of skin cancer and can like reduce like aging, like what types of like habits, like everyday habits, weekly habits, which you make sure that they do on a regular basis?
Yeah. So simplest thing, watch what you eat. Protect yourself from too much UV exposure. Get outside and get moving for certain. Get a little bit of sun, enough that your skin doesn't turn red, but enough that will make you feel better. Get good sleep. And the two other things that I tend to recommend as a dermatologist specifically for the skin is some form of retinoid. A retinoid's usually a topical, sometimes an oral medication that will turn your skin over and grows new collagen. Almost every dermatologist in the world is on a topical retinoid. It protects you against skin cancer, protects against sun damage, grows new collagen, prevents fine lines and wrinkles. It's like the best medicine in the world. And the fourth thing is listen to your skin. If your skin doesn't like something you're doing, change that habit. I see a lot of patients who, I get asked this question, hey, can I put beef tallow on my skin? Every dermatologist saying it's crazy. And I say, look, are you having problems with it? I see a lot of patients who put beef tallow on their skin. Some are young patients who have cystic acne and they're flaring. And I'm like, hey, when did you start your tallow? Oh, yeah, you think it's that? I'm like, yeah, that's probably your problem. And then I have patients who have flawless skin. It's a great moisturizer for them. They've been using it for months without any problem. Who am I to say it's not good for them? Right? So the fourth thing is just listen to your skin, listen to your body. And if you start to find a trend of something not working, let's figure out a way to fix that.
So regarding like the things that you should never put on your skin, we've talked about sunscreen. You talked about like the beef tallow. Is there anything like no matter what people should just not put on their skin if they want to look good over time? I'm on camera a lot, and that's why one of my main priorities is keeping this jawline looking fresh. That's why I'm a big fan of today's sponsor, Vitali Skincare. I've been using their Skin Awakening moisturizer for some time now, and I can already notice a difference in my skin health. I recently had Debbie and Terry Barber on the show, who are the founders of Vitali. They talked about all things longevity, skincare, wellness, what they're doing to slow down the aging process for themselves, and why Vitali is so much different than other brands, and why they're so passionate about skincare. Vitali uses copper peptides that act as a signaling peptide that can tell stem cells to produce collagen, resulting in a more youthful appearance. And the good news is Vitali skincare can be effective on any skin type. And even better news is that they're offering a 20% discount for my audience. If you go to vitaliskincare.com and use the word Doug at checkout, you get 20% off your order. Again, vitaliskincare.com. Use the code Doug to get 20% off your order. Now back to the show.
I think trying to tan in an artificial tanning bed, it's not exactly something you put on your skin, but nothing good will come of that. You don't get any of the benefits of natural sunlight. You don't get any of the health benefits of being outside. All it does is accelerate the aging process of your skin. So it's not a direct thing that we're applying onto our skin, but it's definitely something that's being applied onto our skin by our own doing to potentially look good. It's just there are better ways to stay young.
And what about hair loss? That's something that's
Huge, huge, huge.
a huge topic right now. A lot of talk. Like, what do you think is the best way to prevent your hair from thinning?
Whew. I wish I had this. If I had the answer to that, you and I would be gajillionaires. So hair is fascinating, and something most people actually don't understand with hair is hair is dead. The second it comes out of the skin on our scalp, it's dead. The only living part of our hair sits about 2.5 millimeters in the skin. So this idea that we can put things in our hair or on our hair to help it grow or survive is hogwash. Anything that we put on the scalp, if it's intended to grow hair or keep your hair density around, works by going into the skin to supply some sort of nutrient form to the bulb region of the hair follicle, which is where the stem cells reside. Hair loss comes in many flavors, many flavors. But the most common one that people come in for, which they call hair loss, is pattern hair loss. Male pattern hair loss or female pattern hair loss, we call it androgenetic alopecia, right? And there are things that you can do to help reduce that risk. One, family history plays a huge role in that. And this is one area you and I were just talking about how much does lifestyle or environment play a role in genetics. Here is the one area where genetics trumps all in terms of our ability to modulate it, right? Small things can improve it slightly. Obviously if you're binge drinking every weekend, you're eating a diet, you're not taking care of yourself, you're accelerating that process of loss. Also, if you are staying up late, if you have some sort of dermatitis that's not controlled on the scalp, you're accelerating that loss. But adjusting for that won't grow new hair. It'll help slow down the rate of progression. Now, what you can do, ironically, and this is going to be kind of controversial, but ironically, heavy weightlifting has been theorized to potentially increase the rate of which male pattern hair loss or female pattern hair loss progresses. And the concept behind that is, as you lift more weights, as you gain more muscle mass, the amount of testosterone increases. Testosterone converts to dihydrotestosterone through an enzyme called 5-alpha reductase. Dihydrotestosterone is what grows hair on our chest and what makes our hair fall out on our head. It's also what makes men's prostate enlarge and does a bunch of other things like deepening of the voice and all the androgenic properties of testosterone, not the anabolic properties of testosterone. So ironically, although exercise is something I recommend to everybody, and I weightlift predominantly, heavy weightlifting over time, especially those that are trying to grow muscle, can slightly increase the rate of which pattern hair loss progresses. Now, there are many things that we can do to improve hair loss. There is, certain oral medications that we can use, certain regenerative techniques that we use. I tend to like PRP for hair loss quite a bit, where we utilize our body's own stem cells and growth factors from our blood to stimulate the hair to regrow again. But hair is a stubborn one and it's a challenging one.
And if you were to put together like a nighttime routine or a morning routine for people's skin, like when it comes to like things to maybe put on their face to make their face like glisten, lotion and stuff, like what do you think would be an optimal like 10 to 15-minute routine people could tackle in the morning and evening?
I tend to be a less is more type of guy. I think there's more compliance and adherence when you don't have a 12-step routine. I think fundamentally in the morning, I like to wash my face, or I recommend somebody wash their face with a gentle cleanser. And I have no affiliation with any brands, but Cetaphil, CeraVe, Dove are kind of what we generally recommend in the dermatology space. You need to wash your face, and then you need to have some form of sun protection, whether it's a mineral-based sunscreen. If you're going to be outside for a long period of time, it can be broad-brimmed hat and sun protective clothing, glasses. That's my morning routine. If you want to add the cherry on top to your morning routine, some sort of topical antioxidant. I tend to like vitamin C. It helps prevent oxidative stress from the environment, helps keep your skin healthy and glowing. But that's all I recommend in the morning. In the evening, I keep it even simpler. Wash your face, gentle wash, a topical retinoid, either prescription or an active over-the-counter version like adapalene. That will be the single best thing for your skin health that you can use topically. And then a moisturizer, something that is non-comedogenic, meaning it's been tested not to clog your pores and cause acne. If you follow this morning and nighttime routine, that is 90% of the building blocks for good fundamental skin health that you can achieve at home very easily. Once you build the cake, then you can add the frosting and the sprinkles and stuff. Those are like the added things that you can pay for, like nice, cosmeceutical products. But until you build the foundation, which is really simply those things, everything else is a waste of money and time.
What are some like beauty and cosmetic things that you think people waste their time and money on?
I tend to not like fads. And fads come in waves. You're almost guilted into thinking if you don't do it, you're not doing it right. I think the number one thing people do too much of is overcomplicate their routine. Toners, body specific or face specific serums, load of nonsense in my opinion. I don't think you need a separate eye cream from a face cream, from a neck cream, from a nose cream. I think that's craziness. I think over cleansing is a problem. There people cleanse, then they double cleanse, and they put a toner on, and all of a sudden they come to the office, their skin is irritated, they can't find out why they're developing a rash, and you go through the routine of stuff that they're doing, and it's like 50,000 steps. I'm not a big fan of complicated routines. And then I tend not to like acids, lactic acid, glycolic acids, a lot of beta hydroxy acids that they put on their skin. It's very irritating. You can get the same effect with a simple retinoid. Now, everything we talk about is a generalization. Now, some patients may say, hey, this acid worked great for me. I had acne and I used salicylic acid, great. But in general, when we look at the bell curve, this is the predominant thing I personally tend not to like the realm of fillers. Those are really, really popular. They're kind of waning in popularity now. Because finally we have about 10 years worth of data looking at outcomes and how people do and where these things go. But in the cosmetic space, injectable cosmetics was a huge industry, and fillers, which are these bioidentical substances made from products of our skin that are injected in the skin, predominantly hyaluronic acid. Fillers were tremendously popular and still are very popular. But now we're seeing they're not exactly inert. They're not exactly risk free. They don't exactly reverse completely. And they sometimes move into body parts where we don't want them to move. So they create a kind of a mess. The biggest problem with filler, in my opinion, and any of these cosmetic products is we do things over time and consequences stack up, right? So it's not just like steroids, for example, and I don't know why I'm bringing this up, but it's never the first time or the one time that hurts you. It's you tend to like the way you look, right? Injecting filler, doing cosmetic products, procedures, you tend to like the way you look. The appearance dissipates a little bit, so you come back and do it again 6 months, a year later. You look good, it dissipates again, you tend to do it again. And then when you look back you've been doing this for 10 years and you look back at yourself 10 years ago and you can't recognize the person that was there 10 years ago in photographs. You see this in Hollywood, you see this in celebrity spaces where all of a sudden they've lost their ability to smile, they squint, the eyes are shut, they have really round, I call it, the movie Saw, the Saw cheeks. That's all because of added cumulative effect. That's a consequence. It's never the one time, it's the repeated exposure over many years.
So when we talk about like just bad habits that compound over time, I think that sometimes people just aren't aware of some of the signs that their skin might be bad. They might just say, you know what, like I'm just getting older and that's just a normal thing. I'm pushing 40, I'm pushing 50 or whatever the example is. Like what are some of the signs that your skin is starting to fall apart and you need to go get it checked out before it causes like severe disease?
Yeah, simplest thing is if you have a growth or an area of roughness or redness that lingers beyond a month. It's like my first sign that something's growing there that shouldn't be there. Right. So I think that in and of itself, if you're starting to get what people think are sunspots, and you're getting a lot of them, and you look back at old photos, that's a sign of, hey, maybe I'm doing something that's accelerating that. If you start to develop what look like pimples, and you're beyond the age of acne, you're beyond the age of puberty, and they don't go away in a month, or they bleed easily. Those are signs that, shoot, something's going on, that I need to seek a specialist, a dermatologist, for advice. Everybody ages differently. Everybody has different genetic predispositions to how fast they age. But things that I watch out for that are red flags: a new or changing mole, right? You've had a mole on your arm, or you didn't have a mole there, and now you have a mole that's changing or growing, and it's not gone in a month. You should see your doctor. If you start to see rough spots on the face, redness that doesn't go away in a month, those are all signs of, hey, your skin either is telling you something's going on that it doesn't like, or it's injured and can't heal from too much UV or sun exposure.
People are really self-conscious about their skin and specifically like loose skin. And you talked about like Botox and filler and stuff like that. Um, are there any ways for people to naturally like tighten their skin without cosmetic procedures?
Yeah, for sure. So Especially right now with the like rage of the GLP-1 agonist medications like Ozempic, Wegovy, semaglutide, the generic name. People are losing weight at a really, really fast rate in which the body cannot catch up in replicating collagen and elastin and the fat layers of our skin. So, one of the most common culprits to premature aging is rapid weight loss. I actually think we didn't address this earlier on when you were asking like what is like the most predominant thing that will age people faster. Still remains chronic sun exposure, but rapid weight loss is a big problem because we hollow out faster than we can regenerate that collagen and elastin. And after the age of around 30, the first place we tend to lose weight is in our face and neck and sometimes the arms. And the stubbornness retains around our midsection. It's an evolutionary protective method to protect our organs from loss of energy sources. But what we're seeing now is what I call and many people call Ozempic face, for example. And you don't even have to be on any of these medicines. It's any form of rapid weight loss can lead to premature aging. So things that I tend to recommend, some form of collagen supplementation if you're in that weight loss journey or you have a restrictive diet. If you're a vegan or you're a vegetarian or you don't eat a lot of animal-based proteins, something that limits your ability to get collagen. I tend to like collagen supplements. The data is there that shows us an objective improvement in skin health. And then muscle mass. So as we lose weight, as we hollow, things that will help maintain that elasticity, that turgor, will be things that will help lift the skin. What's underneath the skin and fat layer is muscle. So I do like people to work out. I do like resistance training. I think it helps tighten loose skin. Um, and then obviously, if the hollowing is bad, then things that will revolumize, whether it's surgical or non-surgical, whether it's injections, whether it's things like lifts, those are really, really important. So one of the things that we were talking about was with any sort of rapid weight loss, any sort of change in your lifestyle in which you're trying to get more fit, the thing that we see is a lot of breakdown in collagen and elastin as a result of that weight loss, but also loss of fat, which is the understructure of our skin. And as we lose that fat, that collagen and elastin doesn't have anything to suspend against. So regaining muscle, exercising, taking some form of collagen supplementation, making sure you have adequate protein intake overall. I tend to like animal-based proteins, particularly because of their bioabsorption. Nothing wrong with plant-based proteins, but its bioavailability and crossing the gut to be utilized for muscle building is very low compared to animal-based proteins. Those are all things that can help prevent, you know, wrinkles, deep wrinkles, or things that you can do lifestyle wise that's not medicine or cosmetic surgery based.
And what about like looking younger? Like, is there anything that people can do, like simple things that can allow them to look younger without a lot of time?
Yeah, the two greatest things that we say is some form of sunscreen for too much sun exposure and a retinoid. That's it. That is the best two things you can do for your skin to keep you looking young. The retinoids will turn your skin over, will decrease the sun damage you see, brown spots, dyspigmentation, things like that. The sunscreen or sun protection, it can be a broad brimmed hat, it can be clothing, will help prevent that from forming. That's like fundamental skincare. And then you can add things on, a good antioxidant diet. I tend to like things like astaxanthin. I tend to like antioxidants in whole foods like berries and things like that can help keep your skin healthy, can help improve your skin's immune surveillance and ability to fight damage. But the two simplest things, if you want just something topical you can put on your skin, is a form of sunscreen, like mineral based, and a retinoid.
I'd love to talk about some myths. What are some common skincare or skin health myths you see as a surgeon, as a specialist, that you think people need to stop believing?
Skin cancer is a problem of adulthood. It's not. The youngest patient I've had is 3 years old. Now, there's reasons for that, for people having it that young, but I'm seeing people 18, 19, 20. I have a 27-year-old girl now who's dying of metastatic melanoma. and unfortunately, there's not much we can do about it. So one common misconception is it's not a problem until I get older, and when I'm older, I'll change my lifestyle, and that's impossible because when you develop habits at an early age. So if you start the tanning bed early, or you start tanning at the beach early, you're going to probably continue it for the rest of your life because you're going to like the way it feels, and it becomes a habit. That's number one. Number two is there's things that we can do to reverse time. There isn't things that we can do to reverse time or your genetics, but there's things that we can do to slow down that progression. Skincare needs to be expensive. Load of nonsense. It's one of the few things in which cost does not equate to care, or cost does not equate to efficacy. Some of the most effective things are like $10, $15, and that's all I recommend for a lot of my patients. Other myths. Sunscreen is the only form of sun protection. In fact, in my opinion, sunscreen is probably one of the least effective forms of sun protection. Oftentimes, and you've probably experienced this yourself, you've put on sunscreen and you've still had a sunburn, or you've put on sunscreen and you've had uneven sunburns. And that's because the amount that we got to put on our skin is generally way more than what most people put on. We often tend to need sunscreen in times where we can't apply or reapply. You're swimming, you're hiking, you're surfing, you're skiing. The product wears off, it washes off, and you don't get a chance to reapply. So the common misconception is the only form to protect yourself from the sun is sunscreen. I say shade, shelter, supplement, sunscreen in that order. You can literally never burn if you're in the shade. I mean, literally, it's impossible. You can sit at the beach for 100 days in a row in the shade. You will not burn, but try it for 2 days with a single application of sunscreen, or even multiple applications, you will eventually burn. So these are common myths and misconceptions. Botox is a problem, or they say Botox causes cancer and things like that. That's a load of nonsense. We've been using it in medicine for way longer than it came out cosmetically. We use it for patients with neurologic deficits. We use it for patients with ocular problems. We use it for patients after stroke. It's somehow become villainized because it's a heavily used cosmetic product, but it's a safe and effective thing for people who want some form of pharmacologic wrinkle control.
You talked about kind of being against like chemical-based sunscreens. Obviously, a lot of talk right now about chemicals and everything. What types of shampoos and like body wash and soap would you recommend people use every day?
So again, I'm a simple guy. Soap. My favorite soap, and I'm not sponsored by them, is Dove White Bar Soap. It's what we recommend for newborns with eczema. It's one of our most effective forms of cleansing without over cleansing. There's a lot of so interestingly, dermatology also does a lot of. In the realm of dermatology, we understand immunology pretty well, especially skin immunology. And contact allergy is something that we study very deeply, both in training and in practice. A common misconception that I see is that things that are put on our bodies, or that we put in like our clothing to be washed, are absorbed at any quantifiable amount. These are temporary products like shampoos, soaps, detergents, things like that. And the reality of the matter is most of the products out there tend not to have very dangerous ingredients, or else we would have a quick recall, the FDA would be involved, and more or less the US does a fairly decent job at controlling really bad stuff. The question is what ingredients have some concern but stack up over time? And those are a lot of those in the skincare space tend to be in the preservatives. So I tend to not like products that have a lot of preservatives that allow the product to sit on a shelf. And the simplest way that you can look at things like that is they're usually listed in the last 4 or 5 of the ingredients. They're usually words that you can't easily pronounce. Methylchloroisothiazolinone, right? These strange names, but I tend to look for products that don't have preservatives in them in terms of shampoos and soaps. In terms of detergents, I tend to like simple, free and clear, but those tend not to be a problem as much. But there's a lot of convo about clean, all natural, organic. And those are confusing statements because do you know what's clean, all natural, and organic? Poison oak. I don't put that on my face, right? So the those terms have become kind of clickbaity. But I tend to like the simpler list of ingredients, the better.
Dr. Soleymani, anything else you'd like to add to our conversation regarding, skin cancer, habits, and what can cause and prevent things, etc.?
Yeah, I mean, I, as a skin cancer surgeon, somebody who sees some of the worst skin cancers in the U.S., I think you know 1 in 4 Americans will develop a skin cancer at some point in their life, and 90% of them are in cosmetically and functionally sensitive areas like the face. And if it's not just skin cancer, premature aging is a really big concern for many people. Premature aging, both externally from a skin standpoint and internally. Um, I tend to be on the camp in which the sun is my friend until it isn't. So I enjoy the sun. I think being outside and exercising and getting some sun exposure every single day is healthy. I think there are things that you can do that can protect your skin both from the outside in, like shade, shelter, mineral sunscreens, and from the inside out, supplements that include things like polypodium, nicotinamide, astaxanthin. I take a supplement called sun powder. I help formulate myself that can help protect your skin from the inside out. And we published the randomized trial showing its effectiveness in the New England Journal of Medicine. So, there are many things that you can do to help protect your skin. Just recognize that our genetics, your family genetics, plays a very important role in dictating what your future looks like, but it's not the end all be all. Your lifestyle, your habits, what you do to help correct for that can really improve or change the trajectory of your health.
Well, I wanted to thank you so much for coming on the podcast and sharing all of your wisdom from a science perspective. I think my audience is getting a ton of value out of this conversation. So thank you.
Hey, man, I appreciate it. Thank you so much for having me. If I can help out anybody, please let me know. You can find me on my social media. It's just my name, last name, MD. We have a practice social media, but honestly, I love what I do. I love seeing the improvements right away. Unlike some other organ systems where you can't see our bodies getting better, we see our skin turn and change instantly. So if I can help anybody out, I've done my mission.
All right, man. Well, thank you once again for coming on the pod.
Yeah, man. Thank you. Thanks for having me.